digestive system. Digestion starts in the mouth with mechanical digestion. We've got a hard palate, which is the top part of the mouth, the roof of the mouth, and then beyond that is a soft palate. You can feel the difference if you put your tongue on the roof of your mouth. You can feel the hard palate. Put it back farther, you can feel the soft palate. Okay? Food comes into the mouth, and then we have our epiglottis that will cover the trachea, so food goes down the esophagus. Smooth muscles will, through peristalsis and segmentation, take the food down to the abdominal cavity. So the esophagus is really what connects the front end of the digestive system with the rest of it. Okay, it's the only thing other than the vena cava and the aorta that transects through the diaphragm. Okay, this is part of the diaphragm. You can see the striations because it's muscle, right? They're going to be contracting along here and movement to help pull the lungs down, the chest cavity down, so the lungs can expand into the dead space that's in the pleural cavity. And then we get to the liver. Our liver has multiple lobes. Here you see we have the left lateral lobe that sits on top of the stomach. Left lateral lobe. Left medial lobe. We have the quadrate lobe. We have the right medial lobe. And then we turn it over, and we've got two lobes back here. We have the right medial and then the caudate lobe.
The right lateral.
Right lateral. Sorry, this is right medial, this big lobe right here. The right medial is very large. Right lateral, caudate. So, left lateral, left medial, quadrate, right medial, right lateral, caudate. And then in between here is the gallbladder. And this one, you can see the gallbladder sticking up through. Can you guys see it there? Can you see the gallbladder a little bit better? Okay, so then the food leaves, continuing to trace the food's processed through the digestive tract. It comes down through the esophagus into the stomach, and the stomach is sitting up here close to the heart. Okay, so our very first sphincter in the stomach is called the cardiac sphincter. And that's what you have to get past if you need to throw up. Horses can't throw up because their cardiac sphincter is too strong. And so nothing can come back up. Okay, and then we go through the stomach. We've got a glandular portion of it, which is the lower part. And we have the greater curvature of the stomach, which is the big C. And then imagine a little C, that's the lesser curvature. And then it goes through, the pylorus is here, and then we have the pyloric sphincter. And you can feel this is a tough muscle right here. And then it goes through, goes to the duodenum. And you can see this is the first part of the small intestine. It's a very clearly distinguishable shape. It's before you get to all the twists and turns. And then right between it and the stomach lies the pancreas. Okay? Pancreas is a very fragile organ. If you do any sort of abdominal surgery, it is very friable. If you touch it too much, it gets angry and inflamed, and it's very easy in a living animal to destroy the tissue. And our pancreas is important because it produces a lot of our digestive enzymes, glucagon, insulin, all those important biochemical enzymes. This is the greater omentum. You can see there is an arterial and venous blood supply that goes out to it. You can see that little tiny artery there. So then we go through the duodenum, and then we get to the middle part of the intestines, which is the ileus. And then as we get through...
So the ileus is all the turns of the middle part of the
It's pretty much the middle part. And then we get to the last part, and then we have the jejunum. And you can see here we have all the folds of the intestines. They have a multiple different things that supply them. We've got a artery. You can see the pink there. They'll have a vein. You can't see that as well. It didn't inject. They have a hepatic duct that will...
Which one is the hepatic?
The yellow.
The yellow.
Is the hepatic duct,
Okay.
which supplies the intestinal tract with bile. And then we also have a lymph ducts. You can't see that, it didn't inject, but right here is a lymph node. And so any issues here, they're going to drain. Lymph nodes are an area where all of the lymph in a certain spot will drain to. Okay, so all the lymph is going to drain to this lymph node here. And then we get to the last part. Okay, we have a little bend here. That's where our appendix is, or cecum is in another animal. And we have our colon. And you can see there's a few more right here and right here. There's a few more lymph nodes spread throughout. And then it goes out. And kitty poops. And that's it.